I'm Andrea, and today Nabila and I are going to provide an introductory level overview of what program evaluation is and how to plan it. So by the end of the talk, you should have a sense of the broad definitions of program evaluation, a sense of the process in terms of planning, why it's used, and why it's important. And we hope that the talk will also help you see the value in incorporating it into your own practices, and generally how valuable it is for businesses, companies, and government to invest in evaluation and its related concepts like curiosity, research, and evaluative thinking. And I feel like this is a pretty timely talk because never in more recent memory have we all been so interested in numbers and outcomes and reading graphs and wondering what's happening in the world around us due to COVID. So you can advance the slide, Nabila. So let's start with who we are. Eva just mentioned that we are the Monitoring, Evaluation, and Knowledge Transfer Unit, and we were created as a requirement of a funding agreement between the Public Health Agency of Canada and the Government of New Brunswick. So this funding is for an initiative called the Healthy Seniors Pilot Project, and Healthy Seniors is how it sounds. It is the implementation and evaluation of approximately 40 pilot projects to promote the mental, physical, and creative growth of seniors across New Brunswick. So our unit was created to ensure a few things related to the Healthy Seniors Pilot Project. We were created to ensure that the evaluation plans are strong enough so that we can learn the impact of these multiple pilot projects in New Brunswick. We're also created to ensure that the pilot projects are completed on time, hence the monitoring component of our name. And we were created so we would be able to learn the impact and make evidence-informed decisions. So there is also a knowledge transfer component to our unit as well. So we believe that this unit can also serve as a foundation for future expertise in the area. Briefly, our backgrounds include expertise in evaluation, research in economics, education, recreation, psychology, and aging. And as Eva mentioned, we are the sister site of the MBIRDT, who has a wealth of research knowledge and whose work significantly expands knowledge in the province. So we are very fortunate to work with a very smart and energetic group of people. So you can advance the slide. So first, let's start off with what is a program. I want you to think about anything you or your children or your parents have been a part of for programming. A few examples on the slide include things like after-school programs, exercise programs, smoking cessation programs, art for seniors, gardening programs. Really, the list goes on and on. And at its core, a program aims to impact people in some way. Specifically, we hope that a program changes behavior, improves lives, entertains, educates. These are all reasons why we would implement a program in the first place. And related to this talk is policy. So in some ways you can replace the word program with policy and also conduct different types of policy evaluations. Again, at its core, policy also aims to change behavior, improve lives, or make a change in communities in some way. And there's lots of different examples of this too. We've got policies on smoking, where you can do it, how to label smokes. We have policies on nutritional labeling. These are all aimed at improving public health in some way. And I like to point out, as we all know, we are part of a massive behavioral change policies right now due to COVID-19. So we need to wear masks, wash hands, there's new quarantine policies that have come out, we have to report our symptoms. So we are all taking part of behavioral changes day to day. So the point is that we participate and implement a lot of different things that affect our behavior in some way, whether it is a policy or a program. But the question for this talk is, how do you know that these work? So how do you know your policy or program's component parts are working and that they're reaching their intended outcomes? Often we're very good at implementing a program and coming up with ideas, but sometimes we stop at answering the question, is this working? What is the impact on people who are participating in this program? From a social science perspective, whenever you're talking about someone's change in behavior, our interests perk up because researchers and evaluators know that we can evaluate it. We can look at the outcomes and make some decisions with strategy and with rigor. So you can advance to the next slide, Nabila. So this leads me to, what is program evaluation? So what do we do with all these programs or policies? As I mentioned, we want a systematic way to know they are working. So I figured I'd put a textbook definition of program evaluation on the slide, which is the systematic collection and assessment of information about activities or outcomes of a program, service, policy, process, in order to make a judgment about the program or improve the effectiveness and inform decisions. For me, there are two important points coming up in this definition that are really worth considering. The first is many people point out the word value written into evaluation. When we do evaluation, we're often working with values and making value judgments. And there are many different interacting values to consider when you are doing program implementation. And I'm going to give a couple of different examples. So one set of values might be social or cultural values to a program. We implement programs to enrich our social lives, and there's lots out there, such as creative arts and gardening and multicultural programs. So sometimes we evaluate these programs with that lens. There are other different types of values, like value for money. There's a cost-effective value that sometimes we use when we also do program evaluation as well. And finally, there's knowledge values. There is value of simply doing research and evaluation to improve our knowledge on a topic matter. So these are all core interacting values, and I always advise people to keep these in mind when they are considering the impact of their program and looking at how to evaluate it. The second part of this definition that pops up that's worth considering is systematic or systematic assessment. So I will illustrate this with an example on the slide. So the little speech bubble in the corner says, this vaccine is 90% effective. And I will ask you, how do you know you can trust this statement? Or how do you know you can trust this data? You can bring it into a meeting and say with confidence, this is what we found. Well, the reason why we can be confident on data like this is if it is assessed in a systematic way. And the system that is often used in program evaluation is the scientific method. So if you work with a social sciences trained evaluator and you meet them for the first time, they immediately start talking about rigor, evaluation questions, design, sample size. For some, what might feel like minutia is actually very vital to getting the systematic data or doing the systematic assessment that you hope to do. You can advance the slide, Nabila. So that's kind of the philosophy behind program evaluation, and lots of different things to think of when you are starting your planning process. So what happens now? You have a program and you want to evaluate it. Where do you start? So what we're going to present for the latter half of this presentation is really a simplified steps for the purposes of this talk. So we're going to go through 3 planning stages or steps. Step 1 involves defining and describing your program. Many people often don't sketch out their program's component parts, and it can feel like a big monolithic idea that you have. So what step 1 helps us do is answer the question, what does your program look like on paper? So if you had to give an elevator pitch of your program, what does it look like when you sketch it all out? And for step one, the logic model is really often the first stopping point here. So we'll cover that. And then we'll go to step two, which is evaluation questions. So once you have your logic model in place and you've described it, you understand how it's working, you want to look at it and say, what do I want to know or ask of this program? Ultimately, what do I want to show? Do I want to show that people gain knowledge, improve loneliness, stop doing something, started doing something? This is where you get to get creative and think of some of the evaluation questions that you would ask of your program. And step three involves the identification of suitable methods and indicators, which can be a bit of an art and a science. So how are you going to measure your outcomes and how are you going to collect your data? So with that said, I'm going to turn it over to Nabila to walk us through these 3 steps in evaluation.
Thank you, Andrea, for a wonderful introduction. And as Andrea mentioned, I'm going to take you through the different steps in designing program evaluation. But before jumping into step 1, I would like to talk a little bit about theory of change. So every program is based on some grounded theories or philosophies, and all these are reflected in a theory of change document, which shows how the things that you do are connected to the change. And it can take the form of a picture, a sketch, a narrative, and in our case, it's a logic model. So what is a logic model? A logic model basically acts like a roadmap that helps to visualize the planning process of the program. That means how the program shapes strategies or clarify process and set priorities and illustrating the program to its stakeholders. And in that way, it's more like a tool that is used to kind of present the link among the various resources, activities, outputs, outcomes, and the leading impacts of your program. So in doing so, a logic model essentially tries to identify the gaps in a program's logic, and it can also help the project team to gather the supporting evidence for applying for any funding initiative. So kind of summarizing it, if a logic model isn't logical, and by that I mean that if the components of the logic model aren't clear, then the program is unlikely going to meet its desired outcomes. In the next slide, I'm going to introduce you to a basic structure of a logic model. And logic model differs widely in its format and level of details. However, here is a very basic structure of a logic model that most of the projects will adopt, and it consists of some key terms. So there are 5 components of a logic model, as you can see. So it has objectives, inputs, activities, outputs, and outcomes. So the first step in developing any logic model is to kind of extract all the relevant information on the program and define what are the key objectives. And in doing so, we would like to also list the inputs or resources that is dedicated to the program. And following that, we also need to clarify the activities or what is going to happen in the program systematically and organize them sequentially. So once we have the objectives, inputs, and activities drafted, we are going to look at the outputs or outcomes of the program. And although the words output and outcomes are sometimes used interchangeably, but they have a very different meaning. So outputs are kind of like, in very simple terms, are the units of services. Let's say number of patients seen or percentage of students who graduated, and outcomes are the larger impacts on the participants targeted by the program. And it could take the form of short-term outcomes, medium-term outcomes, and long-term outcomes. So short-term outcomes are all the anticipated change that we're likely going to see in, let's say, next couple of weeks or months after the program has been implemented. And medium-term outcomes are all the anticipated change to be seen in next year and long-term outcomes are like the anticipated change that we're likely going to see over a time span of several years. And while medium-term, short-term, and long-term outcomes are seen sooner, but any program must kind of envision some broader system level outcomes. And by that, I mean impacts on the larger system, such as health sector or education sector. And all the system level outcomes should gather some kind of evidence to support policy change and kind of show government what should be done to make their programs be implemented more efficiently or effectively. And of course, it must be kept in mind that there might be many other external factors that is beyond the control of the program, which might influence implementation of the program. And also there must be taken into consideration all the assumptions or all the conditions that are believed to be necessary for the success of the program. And a very common external factor that we could think these days would be COVID-19 protocols or government-imposed restrictions that are hampering the implementation and operations of a lot of programs across province-wide. So these are some key essential informations that definitely should be kept in mind while drafting a logic model. Let me take you to an example that would help understand the logic model a little better. So if you're thinking about a kind of mental health training program for youth, then one of the common objectives we can think of would be implementation and evaluation of the mental health training program itself. And what are the inputs that we can use? We can think of inputs such as staff, budgets, teachers, facilities, and that can be used to conduct some activities such as training sessions, let's say 10 weeks of training sessions being conducted, or data collection of youth participants, let's say in the form of some kind of satisfaction survey after those sessions have been conducted. And it might lead us to outputs in the form of youth participation. Let's say 10 youth participants have been trained throughout this program, or 10 sessions have been conducted for this training program. And if you're thinking a little bit about the short-term, medium-term, long-term outcomes, then if the program is successful, we are likely going to see youth being more knowledgeable about the causes and treatment of mental health program immediately. And maybe in the medium term, like after a few months have been passed, we could hopefully consider that youths are now able to identify and apply all those health solutions in their day-to-day life. And in the long run, it will eventually improve the well-being of the youth, and it will also kind of try to reduce symptoms of depression in them. So what kind of system level outcome can we think of out of this? We can definitely think that it will reduce number of admissions in the hospital due to suicidal attempts. And it's also going to reduce number of visits to psychologists. So eventually making it more cost effective for the health sector and bringing a broader impact in the health sector. So that takes us to step 2, which is more like the creative part of program evaluation, and that is choosing evaluation questions. So while we are in the process of developing our logic model for the project, it's essential that we ask, what are we trying to know and how are we going to get those answered? For instance, why is this evaluation being conducted? Or what are the requirements that the evaluation needs to fulfill? Or what information will this evaluation bring to the stakeholders for decision making? So when answered, evaluation questions are likely going to show us what has changed for the program, what has worked for the program, and what needs to be improved for the program. So in short, we can say that evaluation questions are all those high-level questions that an evaluation question is designed to answer, and having an agreed set of questions kind of always makes it easier to decide what data collection and data analysis would look like for the evaluation design. We can have 2 types of evaluation questions. we can have process evaluation questions or outcome evaluation questions. So starting with the process evaluation questions, so process evaluation questions are mainly posed during the program, or let's say at the beginning of the program. So it's kind of also sometimes referred as implementation evaluation. Coming back to the example of mental health training program that I showed previously, some of the common process evaluation questions that we could ask would be, is the mental health training program being applied consistently in all sites? Are they delivered within the time sequence set? Are the planning sessions delivered as planned? So process evaluation questions tries to ask all types of questions which is related directly to the rollout of the program. And in the process, it tries to find out what are the supporting factors, or what are the hindering factors that is causing the rollout of the program. We can also have evaluation, or we can also have outcome evaluation questions. And outcome evaluation questions are usually posed after the program has been implemented to assess the program's impact on its participants. As a result, we also call it sometimes summative evaluation. And some of the common outcome evaluation questions we can ask would be, did the participants reduce symptoms of depression after participating in the training? Was there any improvement in their health and mental well-being? Are the participants socializing more within their community and family? So the overarching goal of any outcome evaluation is to examine the end result, and that is the overall change and examine the overall change and outcomes of the program. And while process evaluation questions often do not involve any kind of control group, but an outcome evaluation questions would often benefit by having some kind of control group, where, let's say, if we are talking about the mental health training program and it's applied to different sites, we can, let's say, have one side who received the intervention of the training program and the other side who did not receive the intervention of the training program. And at the end of the program implementation, we can compare the results and see how effective the program has been. So once we have the logic model constructed and the evaluation questions drafted, that brings us to step 3, which is choosing some of the methods of measuring this change. And although this session is not going to be an in-depth coverage of methods, but for the moment, we're going to give you a quick kind of a broader overview. So we try to look at the methods in 2 particular ways. We can have quantitative methods, we can have qualitative methods. And although they are like particular, but they're not kind of always distinctive from each other. And both the methods definitely helps us constructing some indicators, which are nothing but measurable information to provide evidence for your outcomes. So thus, choosing indicators that have clear link between the evaluation questions and outcomes is a very important step in program evaluation. In the next slide, I'm going to talk a little bit about different types of indicators. And as mentioned previously, we can have qualitative indicators, which is more narrative based, or we can have quantitative indicators, which is more number based. And there are definitely many different ways of collecting these indicators. For instance, we can collect quantitative indicators via surveys, we can collect it via checklists or counts, and can represent them into simple numbers, let's say ratios or percentages. Or we can even sometimes construct indexes using all the variables collected through surveys. We can construct Human Development Index. And one of the good things about quantitative indicator is that it allows the convenience to analyze data and make comparisons, since most of them are collected through either primary sources like surveys or secondary sources, which is maybe administrative data. So thus we assume that the primary and the secondary sources would allow us to have enough responses or sample size for having that convenience of analysis. Although quantitative indicators does not allow inclusion of a larger sample size, but it has its own benefits, or it is beautiful in its own way. So there are many different techniques we can use to collect qualitative indicators. We can use focus groups, or we can use key in-depth interviews. We can use documentation review or observation studies. And one of the best part of qualitative indicator is that it lets us hear the whole story in detail. So it's more like you sit with the participant and go really deep into their stories, which allows you to have a better understanding of the program. And even some of the open-ended surveys or in-depth interviews also allows you to gather additional information, like just on the fly if something comes up. And of course, one very important thing to keep in mind is that while we're choosing these indicators, one aspect to keep in mind is that these indicators must be SMART. And SMART indicator basically stands for specific. That means the indicator must tell you exactly what to measure. It must be measurable. That means it should be measured in units. It must be achievable with regards to the capacity of the organization. That is, we must think whether the capacity of the organization allows enough expertise, enough budget or resources for data collection of that sort. And of course, it must be realistic and relevant to the program and time-bound. And in this slide, I'm going to take you to some of the examples of quantitative and qualitative indicators. So some of the SMART quantitative indicators that we can think of would be number of psychology appointments, or number of emergency hospitalizations, or number of sick days due to mental health. And all the qualitative indicators might not look so straightforward, but we can also gather a larger data set through qualitative lens. For instance, on the left side, I have drawn an example from an interview of a participant, which says that, well, you see, I think there is stigma. No one wants to go in and say they have a mental health problem. You worry about what doctors think, what your family thinks. So qualitative and quantitative indicators are obviously very different in the sense of how the data is represented. But although it might look a bit messy, but qualitative indicator itself is data, and but it's giving data, it's representing data from the lens of the participant as a result. And when it comes to decision on which methods to choose, it must be understood that the overall goal of the program evaluation is to get the most information to the decision makers. And thus, we might often benefit from using a combination of both quantitative and qualitative methods, which will allow us for having some kind of triangulation. So that was from my side. I would now like to switch gear to Andrea and give us some concluding remarks.
Great, thank you. So what's next? So Navina, three steps in planning: the define and describe, the defining your evaluation questions, and the choosing the measurement and indicators. The next step for us when you're considering evaluation is how to do it, how to collect your data from the participants. This can involve things like interviews, focus groups, and questionnaires, things that we often call primary data collection. These can also include methods of analysis in terms of administrative or big data sets, such as the type held at IRDT. So there is a wealth of social sciences inspired methodology available to you, and I often advise people to rely on the tried and true methods. And these are often best planned with the help of a consultant or somebody who has had some experience with methodology in the past, because there's quite a bit to think of when you are planning how to do it, more than you would expect. I have a few examples on the slide illustrating the wealth of methods available and what some types of researchers and evaluators like to use. So psychologists sometimes use experiments or quasi-experimental style methodology, where they might have a control group study where one group has access to the program and they look at the outcomes for the experimental group and compare it to a control group who might not have had access to the program and see if there are any types of differences. I have an example on the slide. Sometimes economists like to use the big data studies or the cost benefit analysis to get the outcomes they're interested in. Sometimes educators might use standardized testing to see if their program has had an impact on student scores. So there's lots available to you in terms of methods and analysis. I will say a couple things about methodology. Careful consideration of methodology is really vital for a strong evaluation. And I like to say that you can't travel back in time after an evaluation is done and redo the methodology. So planning methods often involves forecasting how you will collect, organize, and analyze the data. It can involve forecasting about what might go wrong too. So loss of participants, the attrition, maybe messy data. Although we don't always have control over everything, good planning helps minimize some of the problems that you might encounter as you're rolling out your evaluation. So ultimately what your decision about methodology boils down to is a few things: what you can feasibly do and budget for, how rigorous and robust you want your conclusions to be, and what you can implement. So you can go to the next slide, Nabila. So I thought I'd also spend a minute on some general program evaluation planning tips. As I was mentioning in the last slide, it's really helpful to plan your methodology thoroughly. And sometimes it's helpful for a consultant who's done it before and has their eye on some of the things that can go right and wrong in terms of methodology. It's helpful to budget appropriately. Some studies end up being more costly than others. So if you are planning to do a full-blown experimental and control group study, these can be quite costly. You might have to pay participants, you might have to get a large number of participants involved in order to get some reliable data. Likewise, if you want to have access to certain administrative data sets, there may be a cost associated with that as well. Another good tip to think about is make it participatory. Involve your participants in the planning of your evaluation. So if your program and evaluation is targeting seniors, it's really helpful to include them in planning. They might have some insight or something that you didn't think about as you're going through the steps that we talked about. It makes your data more rich and more ecologically valid. Recognize the limitations of your data. As Nabila illustrated on the slide about qualitative and quantitative methodology, each are really interesting and used for different reasons. So qualitative methodology helps us narrow in on a specific group of people and gives us themes and really gets at some of what those people are experiencing, but it's often not intended to be generalizable to bigger groups. So just recognize when you choose certain methods, what you can and can't generalize about your findings. And the last few planning tips are really just general ideas around program evaluation. I always like to say to value creative and out-of-the-box thinking. One of the most interesting and exciting things about evaluation is you get to be creative and you get to find new solutions and discover things that you may never have thought of before. Embrace the minutia of design. If you're a big picture thinker, you may think, why do I have to spend all this time talking about sample size and getting into the nitty-gritty details of evaluation? It is very important to consider all of these details in order to make it the strongest and most robust evaluation that you can do. So I encourage people to embrace these ideas and learn to value different types of data. As was illustrated earlier in this talk, lots of different indicators can be very informative to what you're doing, and it helps to really think through what you want to get out of it. So you can move to the next slide, Nabila. So just for some conclusions, I would say that if you want to build a strong evidence base, program evaluation is key. And there's a number of great benefits to evaluation. It helps to minimize bias. So when you're looking at your outcomes, you're not just relying on somebody's opinion about the program. You're collecting and analyzing things in a systematic way. I will say that no study run by humans will ever get rid of bias or error completely, but we've got a lot of steps to help reduce bias. You can help identify causal links between your program and the outcomes, especially if you're using experimental type of methodology. Program evaluation also gives you the ability to describe the economic and social value of the program. It can help you identify unintended consequences. It supports evidence-informed decision-making, and overall, it helps you improve your programming. So these planning steps that we covered today really help operationalize how you will do evaluation. So you can go to the next slide, Nabila. So I just want to say that our contact information is up there on the screen. And if you like what you heard today, we are planning to have a more fulsome workshop in the fall that covers the elements of program evaluation in more detail. So thank you, everybody.